Hey, deserving listeners, 90-Day Fiancé. My name is Dr. Kirk Honda. I'm a therapist and a professor. Keep in mind that since this is a psychology YouTube channel, everything I say may contain triggering material. I try to give a trigger warning before we get into some dicey and highly likely to be triggering material, but sometimes it just kind of happens out of the blue. Plus, you might have very particular triggers that aren't very common. You know, PTSD and trauma triggering can be very particular to the individual. That's part of the definition of PTSD to some extent. So be careful and talk with your therapist, and keep that in mind as we watch. Let's watch.
Who's all coming?
Libby and Andrei are invited, as well as Charlie and Megan, so.
Still flip a coin on that one.
Well, yeah, I mean.
Babe, you know in my family, just don't ask questions.
Well, I
just
can't,
go with it.
sure.
I don't even know. Just
In our
expect
family,
the worst.
Expect the worst.
Yeah.
My husband set up the
Okay, I don't know if I'm reading into it so much, but, you know, the sister is telling her husband, you know, in our family, don't ask questions and expect the worst. I don't know what that exactly means, but if I was to fit it into my hypothesis, she might be saying to her husband and worried that if her husband is scrutinizing, or at least rationally scrutinizing, that bad things will happen. And so she's basically, I mean, this is me, I guess, biased to some extent, but it's like telling someone, look, you're about to be harmed and you better get used to it because that's just the way it is. That's essentially one message that could be happening there. Or, I don't know, there's a lot of other possibilities, but it is kind of what's happening, right? It's like, you know, my family, expect the worst. How about why do I have to deal with the worst? Like, why are we dealing with the worst? So that's just like par for the course, is that the worst is always happening. Like, why are we dealing with that?
this dinner for me for my birthday and invited all my children. Andrei and I did have a conversation. He said that he would not be at my birthday dinner, nor would Libby. But I mean, I think that she would want to be there, but I don't know that she would actually stand up to Andrei at that point.
Right. And so who knows? It's just so much speculation. But if this is an enmeshed family, at least in the ballpark as to how I'm describing it, that is one of the narratives that you would believe in order to retain the homeostasis and the enmeshment of the past, which is that it's not really Libby making that choice. It's him forcing her, and she is complying with him, but really she wants to be here. And in my mind, I can convince myself that we're still enmeshed and we're still together, because to even allow myself to imagine that one of us would diverge from that means that everyone might diverge from that, right? So it's so interesting, and I'm so glad that they had the cameras around during that first conversation at the beginning of the season, because it was coming from Libby and her sisters. They were yelling. In fact, particularly these two sisters were yelling at the mom, saying like, Charlie's toxic and we're not going to take it anymore. And Andrei wasn't saying anything until the focus kind of eventually got to Andrei, and then, you know, they're standing around that kitchen island, and then he kind of chimed in. But it was mainly Libby's two sisters that were the ones on the charge. And so without that scene, we'd be like, well, maybe it is kind of Libby and Andrei, but it wasn't that way during that conversation. And now it is, not only is it Libby and Andrei, but it's Andrei. It's like, that's the weirdness about enmeshment, is the amount of mental gymnastics that a family will go to in order to preserve the sameness and the proposed stability, the supposed stability that they think they have, is just, you know, incredible. The amount of things that they will overlook. And this is actually what will result in gaslighting. That, say you're in this family and you don't really have any outside influence, maybe Libby before she met Andrei or something, that everyone is like stating this thing. Everyone agrees. They have all these things to back up what they're saying, and you're just like, okay, well, maybe I don't know how to gauge reality.
Absolutely.
I just can't believe that she's listening to him.
No, but really, Mom, you weren't there that night at the barbecue. It was like, I have PTSD. So, you know, I get why Libby is so hesitant. Let me just say, you know, by us being here, it doesn't mean that it's all going to be peaches and rainbows.
I understand that.
Okay, so I will commend this sister for remaining a little differentiated now because the conversation was headed towards Andrei is the scapegoat. And that is in line, I think, with a good portion of her motivation. But instead, she didn't go along with that, at least the way it was edited, and said, well, you weren't there the time when Charlie really was symptomatic and violent, so you don't really understand where this ended up. And I'm here, but know that everything isn't the way that it was, and we're in a we're still evaluating, or I will draw a boundary very quickly, or something like that. Which is confusing because that was not what she was saying last episode. And God knows, if they're coached or whatever, but if we just take it for what it is, what's going on there then? And that's a part of enmeshment as well, is that you don't even know who you are and you don't know what you are, and you might end up being pushed around by the emotional system such that you don't even have your own thoughts. And so in the first scene around the kitchen island, she was going after the mom saying, no, Charlie. And, I think she was the main yeller, honestly, the most, definitive yeller, the most angry person, if my memory is correct. But anyway, so then when the mom was, I think, behind the scenes really trying to convince her and her sister, they started to relent, which we could imagine how that scene went down. Then the next time, the sister is with Andrei and Libby, and she has now returned to Andrei is the scapegoat because she is with Libby in that situation. Then Libby and Andrei are now, so one way to see this is that Libby and Andrei have now extracted themselves to a certain extent from the family system. They've really defined themselves. And energy-wise, Andrei is now so far away, particularly because he's not there, it's harder to scapegoat him, which will happen sometimes. And so now the family system is freer, at least they don't have that to distract them. It's harder to use that. And now she is back to, well, okay, I'm not distracted by my obsession on how Andrei is this weird scapegoat. And I have enough brain space to think about other things. And one of the things that I'm returning to is, well, Charlie still has a problem, and it is still a threat, and I am still worried. Maybe it's because the husband is here, because from the few scenes that he's been in, he doesn't seem like a super toxic individual. So she might be kind of worried that Charlie's going to come and ruin her marriage. Or I don't know. I'm just making guesses. But it's interesting that she's now returning to this position.
From here on out, because we're not there yet. I'm putting myself in this vulnerable situation, but you are my mom, and I'm not going to miss celebrating you on your birthday. Yeah.
So this will be interesting to see how the mom responds, because from the looks of it, the mom is the primary codependent enabler. I don't know that, obviously, and there's not really much data to back that up, but in terms of the little bit of data that it fits the profile, that would be an hypothesis I would definitely pursue first if I was trying to assess the family roles. So it'd be interesting to see how she reacts to that, because on one level, the mom probably has lowered anxiety because the sisters are there, at least some of them, and we're scapegoating Andrei, right? So they were kind of going along with that. But now the sister is saying, look, I'm still kind of on the fence here, meaning I might be stepping outside of our normal homeostasis, meaning to enmeshed individuals, I might lose you, right? I might completely run away from you entirely and you'll never see me again. That's often the worry. So so depending on her anxiety level and depending on her reaction and depending on how they edit it, will determine what she does next. Let's watch.
Yeah. I do feel a little nervous, not gonna lie. I'm not gonna allow anyone's presence or anything dictate me going places or being somewhere. But I haven't actually seen my brother or Megan since the barbecue. So obviously, I think there is a little PTSD from that we are experiencing.
All right, well, side note about people's usage of the diagnosis PTSD in common culture today. Now, I'm not saying she doesn't have PTSD, but people will often throw around this term more recently. It's weird because, I've been diagnosing people for over 25 years, and PTSD is a part of that, it's actually not as common as people think it is. Trauma is common and trauma reactivity is common, but full-blown PTSD is not. I mean, full-blown PTSD is rough. So if your life is somewhat manageable and the trauma is triggering but not like completely awful, that there's a chance that you actually don't have PTSD. Of course, you'd want to talk with a qualified professional and have a full assessment. But what I wish people would say instead was, I'm having trauma reactivity, because that's a much more accurate, less problematic term. Because for people who actually have PTSD, not all of them, but some of them might hear statements like this and be like, you do not have PTSD, believe me. And I have PTSD, and let me tell you what it's like. It's been 25 years of hell for me, and I can't work. I can't have a relationship. I'm barely functioning. I have several medications. I'm absolutely depressed. I'm suicidal. People with PTSD, not always, but they often will have a lot of issues due to the high neurological triggering that happens, the high distress, and then you distance yourself. And it's a very involved diagnosis, very difficult to deal with. But when you have trauma, some event that causes, at least in this category, there's various different definitions of trauma, but the trauma of having a high stress event, a very fearful event, watching two of your family members try to kill each other, that would be traumatizing to a lot of people. You have Chuck, what his reaction. That's why I think Chuck went through a lot of abuse growing up, or at least in the past, because he became highly dysregulated, which is normal. I said that when that happened. He's crying and crying for, I think, a long time afterwards, and having a hard time breathing. You kind of hear that trauma reactivity. He might actually legit have PTSD. I don't know, but so when you see something like that, and you have that neurological fear and terror response, and it starts. If things go a certain way, it can lock in that memory such that when anything reminds you of that event, you can actually have this physical reaction, right? Now, that is the basis for PTSD, but if it's not that symptomatic or not that long-term or whatever, not that severe, where it's ruining your life, then you're having a trauma reaction. And I wish people would just say that. I still have trauma reactivity.
Been doing all right?
Yeah, besides all the, family drama,
We have family drama?
You guys canceled Charlie.
All right, there's that. I think he used that word before, canceled. I don't think he knows. I mean, I suppose he might have his own definition of that, but the common usage of that is if someone has done something wrong, then they incur consequences. The consequence is the society or the group of people will reject and no longer, if it's a boycott or you don't want to see any Armie Hammer movies or any Harvey Weinstein movies or any Kevin Spacey TV shows, or, that's canceling. What he went through, well, I guess you could argue, maybe if you stretch it a little bit, if he thought of himself as a part of the TV show crew, then in a sense, that is kind of true. But what I think's happening, and I think I said this the first time he brought this up, is that it's a reframing of the situation to make him look, he thinks it makes him look better. And whether it's a conscious choice or a subconscious choice, it is a better narrative for his ego, right? Because if he has to really face, so let me talk a bit about this, that when people are suffering from addiction, it's usually been happening for a long time, and usually for quote unquote good reasons, meaning that they have a lot of traumas or emotional regulation or something. People don't usually wake up in the morning and say, like, I'm going to become addicted to something. Sometimes people fall into it for various reasons, but usually it's trauma, and we can imagine this family, there being sources, hard to know. But anyway, so as it progresses, the individual will have several moments where they start to question their use. Maybe it's from the outside or from the inside. They start to say like, and they'll even try to cut back. They'll be like, I need to not use for a while. They will often continually fail and relapse, and they have two choices they can make. They can either continue to try to struggle and fail and feel horrible about themselves while still using, or they can convince themselves that they don't have a problem. They can convince themselves that everyone else is the problem. They could say, like, I could stop at any time. I'm just choosing not to, or whatever. And they might even, and then the spouses often will have a similar conundrum. They can either go against the grain and try to get healthy and fail and fail and fail and fail and create conflict, or they can convince themselves subconsciously or consciously that this is okay. Okay. So if you're operating from that place that everything is okay and that you don't have a problem, and then all of a sudden people are rejecting you for no reason at all. Andrei drinks, everyone drinks, so what's the big deal? And you have to, in order to uphold the denial, in order to uphold this narrative that everything's fine, that you didn't just invent overnight, it was very slow and might have been modeled to you by your mom, for example, because of issues in the history, who knows, but you have to, it's cognitive dissonance, right? It's just like, okay, everyone is now rejecting me, and they're saying that I have a problem with alcohol or drugs, but I know that I don't. So how do I reconcile that? There's this thing in my echo chamber about anti-cancel culture, and that's what this is. I'm being canceled by the libs, by Libby. And it's that, and then every time he hears Rush Limbaugh, or is he dead? Anyway, every time he hears that echo chamber talking about cancel culture, be like, yeah, that's what's happening to me. They're treating me like the way that people treat Donald Trump, and so I'm a victim of liberalism and of people trying to, whatever. I don't know, but it kind of has that smell to me.
Wait, our viewpoint on that is a little different.
One of the main things I want to accomplish tonight is get answers from Jen and Becky about why haven't they talked to my family. So what did I do?
So it's interesting. I mean, of course, it fits with Charlie's personality, but I thought what would happen is that Charlie would actually try to be super cool and super nice and not rock the boat, because he would want things to go back to the way they were. So he's coming at him, or at least he has a plan to be a little aggressive. He's already being a little, maybe it's really hard for him to not be this way. Also, I wouldn't be surprised if he does have a problem with drugs and alcohol that he wasn't using earlier today, because whenever people with addictions will enter into a high stress situation, they usually can't cope without it. So maybe he's a little hopped up on something. I don't know. There's no direct evidence of that, but that could be a factor. Who knows? But it's interesting, and this really lends itself to the notion that his role in the family, or the homeostasis of the family, involves him being really aggressive and argumentative and confrontational and sure of himself, because we've really seen that theme from the very beginning. And so maybe he's like, well, if I return to my old ways, then everything will turn to the old ways. All right, that does it for that episode. I want to thank everyone for liking this episode or any other episode that I've made. It does validate my existence to some extent, truly, and apparently it helps with the algorithm too. But I don't know, sometimes I wonder if the algorithm really matters on YouTube, because my content is so niche that I feel like if you haven't found me, you haven't found me. I don't know. But the like button is nice. Also, subscribing, I suppose, is a nice validation as well. We're far from getting that next threshold. Although we have over 300,000, right? And the next official threshold is at 1 million. And I mean, I don't imagine we'll ever get there, but maybe 500,000 would be another threshold. I'm guessing it'll be years before we get there as well. Well, let's shoot for 320,000. Are we there yet? I don't think we're there yet. Anyway, I'm rambling. Please, please, please take care of yourself. Take care of others. Subscribe where you want to, because you deserve it. You really, really do.